Good afternoon. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 865 new cases of COVID-19. This brings our statewide total to 50,957 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. This includes 3,204 positive cases in healthcare workers. This also includes 2,032 positive cases in workers within the food industry at 120 facilities statewide, and 9,625 positive cases among residents of 495 long-term care living facilities, which include nursing homes and personal care homes. As a result of our continued work to reconcile data from various sources, including the Philadelphia Health Department, we are reporting an increase of 554 deaths over the last 2 weeks. This tragically brings our statewide total to 3,012 patients who have tested positive for COVID-19 who have passed away. To date, all of the deaths have been in adult patients. Again, the significant increase noted today is over 2 weeks and is a reconciliation of our data among a number of different sources, including working with the Philadelphia Health Department. As of 10 a.m., hospitals are reporting that approximately 2,583 patients are currently hospitalized due to COVID-19. 542 of those patients have required the use of a ventilator or a breathing machine. Across our healthcare system, approximately 46% of hospital beds, 40% of our intensive care unit beds, and nearly 75% of our ventilators are still available. As the governor and I outlined last week, testing is very important to make sure that we can identify outbreaks in communities. So I wanted to take a moment to remind residents of northeastern Pennsylvania about our free testing site at the Mohegan Sun Arena parking lot for anyone who has symptoms of COVID-19. So far, 1,259 individuals have been tested at that site for COVID-19. We have significant capacity left to test those who need it. So how do you know if you should be tested? On our website at health.pa.gov, we have symptoms and testing section that gives you great tools to see if you should be tested, including a symptom checker tool from the CDC. Symptoms of COVID-19 can include fever, cough, shortness of breath, chills, repeated shaking with chills, but also diarrhea, muscle pain, headache, significant sore throat, and new loss of taste or smell. You can pre-register for COVID-19 testing at the Mohegan Sun Pocono Arena parking lot at Casey Plaza on our website, or by calling 1-877-PA-HEALTH if you don't have internet access. Again, you can register on our website or by calling 1-877-PA-HEALTH to register for testing. We also have a map of testing locations throughout Pennsylvania for anyone who is looking for testing information. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice, or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands, and don't touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask, like that, if you're going to come into contact with others. If you have questions about your health, please contact your health care provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And I'm pleased to answer questions.
Thank you, Secretary. From WGAL, Dr. Levine, you testified during the Senate hearing yesterday that Lancaster County had community spread. Could you be more specific in terms of what way, what kind of community spread, where is the concern?
Community spread or community transmission means that there are individuals with COVID-19 in the community, and it is spreading from person to person in a widespread way. So, for example, today we have reported that 2,018 cases of COVID-19 have been tested for and are tested positive in Lancaster County. Now, I know there has been a discussion of long-term care living facilities, nursing homes, and the importance of that in terms of the counting in a community and community spread. So 453 residents in Lancaster County in nursing homes have tested positive, but again, far more have tested positive in the general community. And so it is very important for these congregate settings, such as nursing homes or food manufacturing facilities, to be included in the county's counts.
As a follow-up, WGAL also asks, a report about nursing homes, that they're talking about a report that nursing homes are taking COVID-exposed residents. Has that happened, and what about staffing shortages? You had said that there aren't enough tests to do daily, to test workers daily, but what about weekly, and were mistakes made?
So this has been a very challenging situation, one of the most challenging situations with COVID-19 and seniors in long-term care living facilities, such as nursing homes and personal care homes and other congregate settings. So we know that there are individuals that are positive in those homes. We know that there are individuals who might have been hospitalized for COVID-19. Maybe they were positive in the nursing home, they were transferred to the hospital, and then as they are recovering, they are transferred back. Now, we have worked with the nursing homes and personal care homes in terms of guidelines of how to take care of those patients, how to congregate the patients, how to cluster patients and staff separately from one another. And so we are working with them on those infection control policies and procedures. We are working with the nursing homes on making sure they have enough personal protective equipment and have instruction about how to use that personal protective equipment. We have contracted with our consultant ECRI to further those consultations. And in addition, at severely affected nursing homes, we have actually had National Guard medical personnel go in to assist the facility. So we are doing everything we possibly can. In terms of testing, we have had ideas about how we might improve our testing in nursing homes, and we're going to maybe start some pilot programs about how to do things differently, and we'll do absolutely everything we possibly can to protect the residents and staff in these facilities.
From ABC 27, the University of Washington modeling has recently revised its projections upward in terms of cases and deaths because its initial numbers counted on states shutting down until May 30th. And many of them, including Pennsylvania, are partially reopening now. Did you see those numbers, and what's your reaction? So
we have seen the new numbers from the University of Washington modeling, and I think that they highlight the significant risks of opening up too quickly. And that really forms the basis of the governor's careful, phased reopening, going from red to yellow in a very careful, iterative fashion, and then going from different counties and then adding other counties when they're ready, and then eventually going from yellow to green in certain areas as we go across the state. And so this will be done in a very careful, data-driven way. There'll be quantitative factors involved with our decisions. There'll be qualitative factors. We're going to need to make sure that we have testing available as well as contact tracing available. We're going to work with counties. We're going to work with our county municipal health department partners to do this in a very responsible way to try to avoid some of the increases that are seen in that model.
The Scranton Times-Tribune also asked on this question, since the model now predicts more than 8,600 deaths in Pennsylvania, was that what you expected before the restriction loosening announcement on Friday? And if it's higher, are you making a mistake by letting the 24 counties loosen restrictions?
No, again, we're going to go in a very careful way. So I did not know what the number was going to be before the model came out, but it is concerning, and I think that it shows the risk of going too fast in terms of reopening. And again, that forms the basis of the governor's very careful, phased plan.
From ABC 27, Secretary Levine, for the second straight day, the new confirmed case number is below 1,000. That seems like good news, but the death number increased by more than 500. That seems like really bad news. What should the average Pennsylvanians make of today's statistics?
So I would agree that a number of days in a row with more than 1,000 new cases is positive news. Now we know that we get less case reports into our system over the weekend, but today's Tuesday, and we still had less than 1,000. So that is promising. We're going to need to see if that trend continues because the numbers and the data over time is the most important metric. Now, with the death reporting, as I've been saying, that involves a reconciliation of data from a number of sources and does not represent the number of deaths in one day. It really would represent the number of deaths over several weeks, but some reconciliation of those data resources, particularly with the Philadelphia County Health Department. As I've mentioned, they use a different data system, but we do recognize that this is really challenging for people to understand. It leads to concerns in terms of the regularity of our data. So in discussions with the governor's office, we're going to work to put in place the changes in terms of our system and working with our other data systems and with Philadelphia to try to reconcile that data on a daily basis. So we're discussing those plans now, and then we'll be discussing them with Dr. Farley, and we're going to work out a much smoother way to reconcile that data in the future.
From Spotlight PA, Secretary Levine, why is the state not releasing the ages of people who have died of COVID-19?
Well, so we have discussed the ages in general. So clearly, the majority of deaths of individuals with COVID-19 are seniors, those 65 and older, and particularly those with chronic medical conditions. That includes heart disease, uncontrolled hypertension, chronic lung disease like chronic obstructive pulmonary disease. That includes chronic bronchitis and emphysema, severe diabetes. And so we have been discussing that. We haven't put out the exact numbers, but there's a lot of information available on our website, and we're always working to give the public more information so that they understand the situation in terms of the public health implications of COVID-19.
From Capital Star, there are more than 3,000 confirmed cases of COVID-19 across Luzerne and Lackawanna counties. Are you concerned that the testing number at Mohegan Sun is a little low?
Well, we want to improve the testing numbers at Mohegan Sun, and so we felt it was very important to put one of the mass testing sites, which are free. You actually don't need a doctor's order. You can go online or call now to register to get a test, and that was the purpose of my mentioning it today as well as last week. We want to do everything we can to encourage people to come to this convenient, free mass testing site if they have any symptoms, as I have just discussed, of COVID-19.
We have similar questions from Fox 56 and the Philadelphia Inquirer regarding nursing homes. Patients and family members of patients in nursing homes have told us that the conditions aren't the best, especially when patients are suffering from the virus. What can nursing homes do to keep patients safe right now?
Well, so we are working with those nursing homes, and I believe that they are trying. I think it's an extremely challenging situation with this very contagious respiratory virus, COVID-19, in those type of settings with the patients that are most at risk, as we've been discussing, seniors and seniors with chronic medical conditions. So we have many different ways that we've been interacting with them, with guidance, with pushing out the federal guidance, updating our guidance. We have regular phone conversations with these nursing homes. We have virtual consultations with them. We have our consultant, ECRI, and then when necessary, we have National Guard strike teams able to go in and to help them. And then we're considering other ways of testing, so we'll be discussing that in the future, at least on a pilot basis. So any way that we possibly can help these facilities, we will.
From the Philadelphia Inquirer, many people want to know the coronavirus status at nursing homes where their loved ones are living, but they continue to have a hard time getting that information from those facilities, and health officials won't release that information. Will the Department of Health continue to not publicly disclose this information and leave the relatives of nursing home residents in the dark about what's happening at specific facilities?
Well, first, it is the responsibility of the facility to notify the family members about the condition of their loved ones in the facility. But we understand that that communication has not been as good as it should be. So we're trying to balance the privacy concerns and their actual legal right to privacy for the residents of the nursing homes versus the loved ones and the public's right to know. So we're having those robust discussions, and we'll have an answer this week.
From the Lewistown Sentinel, 3 state legislators sent a letter to the governor's office on Monday wondering why, despite Mifflin County's relatively low case count and the fact that some counties are permitted to enter the yellow phase on Friday, have a higher per capita case count, that Mifflin County wasn't among those moving yellow. Why is Mifflin not able to move to yellow despite its case numbers and being bordered by 3 counties that will go to yellow on Friday?
Well, so we are going to be looking at all of that data. We have a new run of data coming out this afternoon. We'll be looking at the run on Thursday. We'll be reviewing all of our data. We'll be reviewing the Carnegie Mellon data this week, presenting that to the governor for his decisions about the different ways that counties will move forward.
From the Altoona Mirror, a local gym opened yesterday in defiance of your order, and the owner says he intends to remain open despite 2 citations from local authorities. Would you like to comment?
Well, I'm not familiar with this gym. I think that it is not the right thing to do for gyms to open. We are concerned about the spread of COVID-19 in facilities like that, particularly in red zones. And no county has gone yellow today. They start on Friday the 8th. So when those are detected, then they're reported to the Department of Community and Economic Development for an enforcement work group, and then if necessary, local authorities can be contacted.
From Penn Live, what have the science and health communities learned about warmer temperatures in relation to coronavirus? As temperatures rise in May while summer nears, have there been any encouraging findings from this perspective?
Well, we have not seen that in Pennsylvania yet, but of course it's been episodic in terms of the temperatures. There is some suggestion from other countries that the virus is transmitted less in warmer temperatures. So that is hopeful. It is not definitive, and so we'll have to see in the United States what we see as we head into summer and warmer times.
Also from Penn Live, Secretary, I understand that at today's Board of Pharmacy meeting, a letter from the deans of the pharmacy schools was discussed in which they asked to have the 2-year lab experience waived from the Lab Act to allow more pharmacies to serve as antibody testing sites, and in turn, helping achieve the governor's goal of 90% of Pennsylvanians being within 45 minutes of a testing site. Is there consideration being given to their request?
Well, I'm not familiar with the proceedings of the Board of Pharmacy this morning, and we consider all requests to be in terms of helping, in terms of the healthcare response to COVID-19. In the end, that's the responsibility of the Pharmacy Board and the Department of State to take up those considerations.
From the Daily Press, During Monday's briefing, in one of your responses, you indicated that wearing a mask will not be mandatory for counties in the yellow phase, but instead will be highly recommended. If masking is not mandatory in those areas beginning May 8th, will businesses in those areas be able to deny customers from entering or denying them service if they're not wearing a mask?
Well, I want to clarify. We strongly feel that masks are a very important part of the quote-unquote social distancing that we have talked about for communities and for people, whether it's green, red, or yellow zones. And the governor has said over and over again that we expect the Pennsylvanians to do the right thing, and the right thing for themselves, the right thing for their families, and the right thing for their communities. And as I say every day, the right thing to do if you're going to be in contact with other people is to wear a mask.
From the Daily News, do you plan to do universal testing at SCI Huntington to get a true handle on the number of positive cases, as there is an outbreak with 51 inmates and 24 staff testing positive for COVID?
We'll be discussing whatever is necessary to protect individuals there with Secretary Wetzel and the Department of Corrections.
Also, from the Lewistown Sentinel, Huntington County recently, due to mainly numbers of its state prison inmates and prison staff contracting COVID, has seen a spike in its total. Will spikes in cases prevent neighboring counties from going yellow? And if so, why are some counties that border Huntington, like Center, able to go yellow on Friday, while others, like Mifflin, are not?
Well, so as the governor has been saying, I mean, we're looking at counties, and certainly, as I've emphasized today, whether it is a long-term care living facility, whether it is a correctional facility, or whether it is a food processing or manufacturing facility, they are all part of the county. They all have employees that work in those counties and live in those counties, and could contribute to possible community spread in those counties. So they all will be included in a county's count. What happens in one county is not always necessarily going to influence what happens into the county next door to it.
From WBRE, can we expect any counties to move into the green phase before the rest of the state has moved into the yellow phase?
We haven't made those determinations yet. Again, there's only 24 counties that are going into the yellow phase starting on Friday. We'll be making other determinations in terms of counties that might be able to go from red to yellow. We actually have not discussed yet exactly when and how counties will go from yellow to green, because we're not there yet.
And then from WNEP, several counties that have low numbers of cases are not being moved to the yellow phase on Friday. Is the state concerned about businesses in those counties defying the order and opening up on their own, and what would the consequences be? Well,
we are certainly concerned, and it is very challenging for Pennsylvanians in terms of the economy and in terms of businesses during the stay-at-home orders, and we realize that. And we're going to be working with the governor's office in terms of all of the different factors that we've described in the decision for counties to go from red to yellow. And as the governor has said, we expect Pennsylvanians to do the right thing and to follow the social distancing guidelines.
From the Philadelphia Inquirer, Pennsylvania has more confirmed cases of the coronavirus among meat production workers than any other state, according to the CDC. How exactly is the state tracking the safety of these workers, and are there plans to publicly release information about specific plants with outbreaks in order to protect workers and consumers across the state?
Well, we are working very diligently, really, among every level of government and through the agriculture industry on food processing manufacturing facilities. We have had very regular discussions with Secretary Redding and the Department of Agriculture, even today, about these facilities. We have been working with the food processors and manufacturers in terms of the facilities. We have had food safety inspectors from the Department of Agriculture advising on on-site measures. We did have a April 15th worker safety order that does apply to all businesses and gives additional steps if the workers are exposed. Again, we are working with an interagency way with the governor's office to protect these facilities, and we will continue to do that.
From the Butler Eagle, the public is watching the raw total numbers you put out and making their own assumptions. Has the department considered providing more information, such as a breakdown of when tests were taken, to elaborate and give context for its decisions?
Well, I really feel that we have been very transparent in terms of the data that we have put out. It's actually unprecedented for state health departments, including ours, and really all of the state health departments in terms of the amount of data that we are putting out on a daily basis. We are always looking to improve our data, improve our transparency with data, and we'll continue to do so.
From WNEP, concerning counties in the Northeast region that have low numbers of cases but are remaining in the red phase for now, we know that state lawmakers and others have sent letters asking for those specific counties to be allowed to reopen. Are you considering requests for individual counties to reopen while others in a region remain closed?
Well, the governor has always said that we're not going to be beholden to any specific schema of regions, and we certainly take seriously any letters to the department or the governor's office from the legislature.
Also from the Butler Eagle, since April 21st, Butler County has had 22 new positive cases. They have a population of more than 180,000. This trend was apparent when the decision for the first waves of yellow counties came as well. What is holding back Butler County and others like it? What is it that borders, is it because it borders Beaver and Allegheny County directly?
Well, we had been looking at the counties and counties within regions in terms of our initial decision, using the metrics that we have described, using the data from Carnegie Mellon University, as well as our testing capability and our contacting tracing capability, to make the decisions for the 24 counties to go from red to yellow in May. We'll be continuing to look at new data, both our data as well as from Carnegie Mellon. We're going to be working on with local authorities in terms of our testing capability, and then we will be presenting that information to the governor for his decision to consider other counties that might be able to go from red to yellow.
From Lehigh Valley Live, the National Guard started helping out at Graysdale Nursing Home in Northampton County. Where else is the Guard assisting, and will the Guard be available to help private nursing homes as in New Jersey?
So, yes, the National Guard is available to help in any of the long-term care living facilities that need help. I actually don't have specific data on which facilities the National Guard has gone into, but they are available to go in any facility that needs their help.
From WKOK, Pfizer began testing multiple versions of an experimental coronavirus vaccine in healthy young people in the United States this week. And their stated goal was to have a vaccine ready for use in high-risk groups by the fall. Do you see that being realistically possible?
So I don't have specific detail of Pfizer's testing that they're doing. I have heard that they have started to do testing. I'm sure we all wish them well in terms and success in terms of their goals of developing a vaccine. We'll have to see what the timetable is, but the sooner the better.
Also from WKOK, you said during a Senate hearing today that the department will not supply PPE to hospitals going back to elective procedures. Why is that?
Well, we feel that if hospitals are able to go and do elective procedures, those elective procedures require personal protective equipment. And so if they're doing an operation, then they need surgical masks, they need gloves, they need gowns. And so if they're able to do those type of non-emergent procedures, then it is evident that they have enough personal protective equipment, so we won't have to send that to them. We do want to prioritize our personal protective equipment, such as those gowns and masks and gloves, to facilities that have very large amounts still of COVID-19 patients, such as several different hospitals in the Philadelphia area and in some of the collar counties, as well as the challenged nursing homes, personal care homes that we've been discussing who definitely need PPE. So we're going to have to prioritize to them.
From WKOK, anything new from remdesivir or other treatments? What about antibody testing at the Exeter lab? Any progress there?
Well, there's nothing new in the last several days about that medication, and so we'll be looking for more standardized test results and trials to see the utility of it. Again, it has shown some promise in terms of helping patients that are in the hospital with an IV preparation for the sickest patients, and that's great. So we're going to wait to see what other types of medications become available, but it's very promising.
From the Citizen's Voice, When is the testing site at Mohegan Sun expected to close, and has the site met the state's expectations?
Well, we want more and more patients to get tested there. It has met our expectations, but we want to exceed our expectations. I have no timetable in terms of when it would close.
And then also, our last question today is from News Talk 104.1. Currently, there are 50,957 positive cases, and as of today, 2,580 in the hospital. Does that mean that 4,377 cases have recovered?
I'm going to have trouble with calculations and data off the top of my head. Really, as we look at the number of patients that we have had over time, and we know the mortality rate, and we know those have passed away, the majority of those patients have recovered. We are not able to contact all of the 50,000 patients over time to know exactly when they recovered. And so it's really challenging for us to give recovery rates, but we're very pleased that the majority of patients that have had COVID-19 have recovered.
Thank you so much, Secretary. That concludes our briefing for today. Our next briefing will be tomorrow. For any media that we were not able to answer your question, the Department of Health Communications Office will respond in the next 24 hours. Thank you.